My name is Josephine Gitome from Kenyatta University in the Department of Philosophy and Religious Studies. I'm involved in research with Jennifer, and we are working on research on migrant mothers, digital maternal healthcare. So far, we've been in Dadaab and have carried out research there on mothers and their support, the support they get from traditional birth attendants.
Thanks, Josephine. Yeah, and I'm Jen. I'm based at Newcastle University. And as Josephine has mentioned, this project, Migrant Mothers, it really is an international collaboration between academics and practitioners at Kenyatta University and those at Newcastle University. It also includes refugee women themselves living in Dadaab, which Josephine mentioned. And some of the listeners might know that this is one of the largest and longest standing camps in the world. It borders Somalia and is based in Kenya. Over 200,000 people live there. Many of them are women, and many of them are reproductive age and give birth in these camps, sometimes multiple times through their lives. And our project is really interested in the experience of giving birth in a humanitarian context like Dadaab. And as Josephine has already pointed out, we're specifically interested in the role of the figure of the traditional birth attendant, or the TVA. And this is a woman, often an elderly woman, who's very revered in the community, trusted, has provided many sort of supports throughout many women's birth, but she's not been medically trained. Her training is informal. She's learned through practice. And a lot of her informal training is around the cultural protocol of what it means to help a woman give birth. In Somali tradition, we're working mostly with Somali refugees. And we've become really interested in this figure because even though she has no legal place, actually, within the camps, she's been outlawed as the figure. Her role is still considered very important among many of the women giving birth, right, Josephine?
Yeah, it's very interesting to find mothers in this time and age who will opt to go to a traditional birth attendant in a place where they have very good hospitals managed and sponsored by UNHCR. We have Red Cross in Kenya, and also we have the International Rescue Committee hospitals, and they are very good. But these mothers, some of these mothers would still prefer to go to the traditional birth attendants. So we were interested to find out why. And some of the issues that came out includes burying the placenta, not wanting to expose their bodies to men midwives, and especially those mothers who have had FGM, that is female genital mutilation cut. They feel shy about this, and therefore they prefer to have the TBAs support them in giving birth. Going to specifically to the issue of burying the placenta, we note that they relate with the placenta like their own body. And even though it has been removed, they still have cultural beliefs and practices that make them want to bury it about 4 feet deep, cover it very well with soil in a place where they feel is secure. And this is contrary to the hospital practice of putting it in the waste channels in the hospital. So they feel very uncomfortable with that practice, and they would rather prefer to go and bury. So since the traditional birth attendants give them that opportunity to respect their cultures, then they prefer that to be in the place of trained midwives, unfortunately so.
Yeah, I mean, it's a complicated relationship, right? And this is what the project is really interested in, is that exactly like you said, Josephine, that although there are these medical facilities, many women are still choosing to work with the trusted midwife or the traditional birth attendant. And our work has been interested in sort of documenting some of the stories, both of mothers giving birth, trying to understand their preference for working with TBAs, also interviewing traditional birthing attendants themselves. And the medium that we've used is virtual reality, VR. And so women have been trained in VR. They've been given some basic training through one of our partners, Black Rhino, a VR company based in Nairobi. And women were actually steering the narrative of these VR itself, steering what it would tell. What is the story it would tell? And through this process, we have documented some of these lesser known practices, these informal networks of care. And we see this as part of a decolonizing of maternal care, actually, is that we're trying to understand what are these cultural practices, mostly of Somali women, that have been largely foreclosed in medical spaces, sometimes for what we might think of as good reasons, for healthy reasons, but nonetheless, really these are important cultural practices that we need to understand. And so we've been using VR for that purpose. And some of the women we've talked to have been very moved to see their own stories represented in this medium, and very happy to know that we're taking that VR and sharing it with other maternal health practitioners, such as the UNHCR, which Josephine already mentioned, or the Red Cross. And we're trying to create an intercultural dialogue around maternal care in the camp, even though these are figures working in the same space, TBAs and the UN. Too often they're not coming together to have a conversation about providing care. And so our VR is hopefully bridging some of those conversations. It's also meant to be a toolkit for training future midwives to understand the protocol. At present, there's no training for midwives around traditional birth and attendants, and we see that as a gap that our work is trying to address. And,
sure. The stories we've corrected, put in the VR toolkit would be very helpful in the future in terms of equipping our midwives in the universities and middle-level colleges. We are hopeful that this curriculum can be enhanced with the stories in the VR toolkit, informing the midwives to be how to manage culture when they go to serve in places where culture sometimes is considered of more importance in the process of delivery. And so they will help the mothers feel comfortable coming to the hospitals because they are giving them the space to practice their culture. For example, in the issue of burying the placenta, it is as simple as just packing that placenta for the mother to take away and bury in her best of choice spaces back at home, within, of course, the Dadaab camp, or if that has to happen in another part of the country, I think it will go a long way in enhancing the choices for the mothers to come to hospital instead of being helped by a TBA who most often than not is not trained professionally, but has these cultural practices and has these preferences for the delivery at home, and sometimes they don't have all the tools that is required.
Yeah. Absolutely, and I think it's exactly that, isn't it? That our project is, the impact is to make some of these choices more robust for women to know that if they go to the hospital, some of these cultural practices will be respected and they'll be able to give birth with dignity. And this is the kind of decolonizing work of midwifery practices that we're interested in a place like Dadaab. And moving forward, we hope to expand some of this work to other refugee camp settings, which we've been exploring, and just to highlight, I suppose, some of the other outcomes of this stage of our work. We've produced this VR that we've mentioned, which was selected by the UN Sustainability Development Goals Festival, where they shared with hundreds of humanitarian workers. We got some great feedback on the VR as it stands, and we've published our work in academic journals, including Dialogues and the African Journal of Midwifery Studies. So we're continuing to do this work, both thinking about intellectually this challenge of maternal care, but always grounding this within an eye to thinking about change on the ground, how to make these maternal care practices more more welcoming and more inclusive to the women who are actually needing this maternal care. And this is the work we're going to continue to do, right? As we finish the first stage of our research, we're going to continue to expand this in other contexts and further think about how to embed some of this curricula into different educational platforms.